Hi, my name is Jennifer Hull and I'm a registered nurse. Today I'm going to be discussing with you a teaching plan for otitis externa, otherwise known as swimmer's ear. I will be covering assessment, causes, pathophysiology, diagnoses, treatment, nursing diagnoses, desired outcomes, patient teaching, and prevention. First, let's start with the case study. Jay is a 17-year-old on his high school swim team. He presents with sudden onset of right ear pain that worsens at night. He says that the pain intensifies when he touches his ear and has a feeling of fullness inside the ear. On examination, we can find the auditory canal is swollen and red with yellow crusting. His temperature is 98.7. His tympanic membranes are pearly with landmarks intact. The patient has been prescribed eardrops that a family member will be administering for him. Okay, so what is swimmer's ear? It's an infection of the external ear canal. It can be acute or chronic in nature. Generally, it resolves within 1 week, and early treatment is key. On assessment, we can find a history of frequent exposure to water, sudden onset of ear pain that worsens at night, pain when touching the ear, and a feeling of fullness. Clinical findings include the patient being afebrile, he has pain with palpation, swelling, redness, and yellow crusting to the ear canal, and intact tympanic membranes. Causes of otitis externa include Staphylococcus and Pseudomonas as common pathogens which occur frequently in swimming pools, humidity, excessive moisture, scratching or trauma inside of the ear, such as the use of earplugs or Q-tips. The pathophysiology of this infection begins as frequent exposure to water, the decrease, which causes a decrease of protective cerumen layer in the external auditory canal, which causes an increase in pH and itching. Itching causes the patient to scratch, which leads to tissue trauma, and this trauma causes inflammation of the ear. So with all these in mind, the external auditory canal becomes warm, moist, an alkaline environment, all of which put the patient at risk for increased growth of bacteria, hence the otitis externa. Next, we can move on to diagnosis. How do we diagnose otitis externa? Well, you can usually diagnose with otoscopic examination, and you will find erythema and redness, which is redness, edema, which is swelling to the external auditory canal, and will also have purulent discharge. In addition, the pain will complain of pain, which is worsened by touch and manipulation of the ear. Also, a culture of the drainage can be done to determine the causative organism. How do we treat otitis externa? Well, first you can begin by cleaning of the debris from the ear canal by using a tissue and gently remove any visible drainage from the ear. Again, with emphasis on not using Q-tips inside of the ear canal. Also, avoidance of exposure to water for 2 to 3 days. With swimmers, they may resume swimming activities, but they must try to keep their head above water as much as possible until their symptoms resolve. Pain management, you can use Tylenol, or if there's a prescription for Tylenol with codeine, if the pain is severe. Also, the use of an antibiotic corticosteroid eardrop such as Ciprodex, usually the course would be between 10 to 14 days. Nursing diagnosis for otitis externa, you can include pain, sensory impairment such as hearing loss, and a risk for infection. The desired outcomes include decreased pain, increased comfort, resumes normal auditory function, and no evidence of infection signs and symptoms. Next, let's move on to patient teaching of installation of eardrops. First, have the person who's going to be instilling the eardrops wash their hands. Have the patient lay on the side with the affected ear facing up. Straighten the ear canal by pulling the auricle of the ear up and back. For example, this is the auricle of the ear, and you will pull up and back for adults. And this allows for straightening of the ear canal. You will remove any physical drainage from the ear with a tissue. If there's too much drainage, the medication will not be effective. Now, while holding the ear in the straight position, with your other hand, gently place on Jay's head with support, taking care not to contaminate the tip of the dropper, and instill the number of drops ordered. Hold the ear in position until the medication is no longer visible. Next, allow the patient to massage the tragus of the ear with a finger, and that way this will disperse the medication and allow for the patient's comfort level. Have the patient lay 5 to 10 minutes on their side and clean any excess drainage from the outer ear if necessary. And again, wash your hands. Repeat these steps for the duration of the time the medication is needed. Also, you must instruct the patient and the family members to contact the care provider if no improvement of symptoms occur after 48 hours of starting treatment. Also, if new symptoms develop, such as fever, redness, pain, or swelling behind the ear, contact your physician because this can be indications of a chronic infection. Last but not least, let's make sure you teach on prevention. How do you prevent otitis externa? Well, you can instill 2 to 3 drops in the ear of 1:1 white vinegar and 70% ethyl alcohol before and after swimming. You can also have the patient wear earplugs, keep their head above water as much as possible when swimming. When water exposure occurs, dry the ears with a towel or a low-setting blow dryer after exposure. Again, avoid cleaning the ears with Q-tips. This will allow for a decrease in trauma to the ear. And avoid washing the ears with soap, which will allow for a decrease in alteration of pH levels. So if you include all these steps when teaching your patient, you will be able to properly educate them on otitis externa. Thank you very much.